Neurological Maximum Training Solutions. So recently I posted on Instagram about a patient that has a really interesting vascular disease that she was diagnosed with when she was 9. Really been struggling with a lot of her foot mechanics and accumulates a lot of fluid on the bottom of her foot, which gives her a lot of pain, a lot of irritation. The biggest issue is she really doesn't have any good foot structure on that side, so it's really carrying up to left hip pain, low back pain, right shoulder pain, because the issue is actually on her left foot. And the other thing is that fluid causes her a lot of pain and discomfort. So traditional orthotics have not been a good solution for her, because the only orthotics she tolerates are soft orthotics that really don't give her any support. So what I chose to do with her to help me sort of jumpstart this process of corrective exercise up the entire chain was we used a tab technique for taping her foot, which has worked really, really well for her. So we have to use a tab if we're going to do this because we're going to put stretch on the tape. And those of you who've taken any of our rock tape courses, we really don't teach stretch on tape anymore because we're looking so much at the neurological effect. But there are times when we can use some stretch on tape and get away with it if we use a tab in order to protect the skin. So that way we aren't getting blistering or skin irritation. So that's what I'm going to do on the medial side of the foot. And the goal is really a few different things. Number one, neurologically help her so she understands when she starts to pronate, she feels this stretch on the tape and she goes back to neutral. Then mechanically, because we're putting a maximum stretch on the tape, mechanically we're able to really support the foot because we're using as much stretch as we are. And the other thing we're doing that I think is an interesting concept is we're actually pulling the skin together on the medial side of the foot with the stretch, which sends a signal to the brain that we're actually sort of closing that joint up, which I don't know that we can prove scientifically, but I think conceptually it makes a lot of sense. So what we're going to do here is first we're going to start with a tab. So just a small piece of tape, and I'm going to tear it in the middle like we would with the Band-Aid technique, and then I'm going to fold it on itself. So I'm going to go something like this. So this is what a tab looks like here when we're all done. It's folded on itself, something like that. Then I'm putting that right on the navicular. So now I've got this tab right on the navicular, and now I can really take and drag that tape, and I have really good control over that area of the foot. Then I'm going to take a normal piece of tape here, grab my anchor, and I'm going to anchor it on the lateral side of the foot, and I'm going to take it right across the bottom with no stretch. Now I want to put her basically in subtalar neutral, or even bias her just a little bit into supination so she gets that maximum support. And then I am locking it down to the tab. So that's the important part here. So I lock it down to the tab. So now when I put this on, I'm actually going to put my thumb right on this tab so I make sure I don't tear the tape or rip the tape off of that tab. Put her where I want her, and then I'm pulling my paper back. If I can get the paper to cooperate with me here. Pulling the paper back, and then what I'm going to do is I'm going to go maximum stretch over top of the foot and kind of use my forearm to lay it down. Try not to get any wrinkles there. So now I've got a maximum stretch across here. And then once I get to the lateral side of this lower leg, I'm just laying the tape on without any stretch and sort of doing a helical taping around the lower leg. So I put the tab on, maximum stretch across the top, and then just laying it on with a long anchor, essentially with no stretch. So that gives me really good support here, really closes up that joint, and gives a good neurological feedback to the brain that I want to keep that good neutral position. Want more information? Always just check out social media or website at MaximumTrainingSolutions.com.